I've said this before and I'm saying it again. You might have endometriosis without you knowing. You see all those chronic pains you used to have whenever you are seeing your period, especially when you are taking ginger tea, like you have been taking ginger tea, and ginger is not helping with the pains, because normally ginger is supposed to manage your menstrual pains, because you can see a lot of people talking about how they no longer feel pain whenever they're seeing their period because they're taking ginger tea. So that one is normal, trust me. But you see that pains whenever you take ginger tea, or even when you, in fact, when you have been on ginger tea, or even take any pain relief or so, yet you are still dying whenever you are seeing your period. You might have endometriosis. So say that you are going to hospital and doing scan, and they're not telling you have endometriosis does not mean you don't have it. Endometriosis can be in your system for years without you knowing. Yes, it can be in that your system for years without you knowing, because normally they don't see it in scan. The only time that it can be, this endometriosis can be obvious in scan, maybe when you have cyst. You know, we have chocolate cysts that form due to a high level of endometriosis in your system. So when this cyst is formed in your system, it's called chocolate cyst. Normally they call it endometrioma. So when they see this cyst, they will not be telling you have endometrial issues. Okay, but then it has been there before that cyst, and that is why you have been dying of pains. No matter what you do, you are dying of pains. For people that will be telling me, I'm taking this, I'm still dying of pain. If you're not taking something that targets endometriosis, you're wasting your time. Trust me. You see those pains you're having, no matter what you take, as long as it's not something that is targeting that endometriosis, you're not going to be okay. You will keep dying in pains. If you like, take fertility herbs that are good for hormones. If you are not taking something that is targeting that endometriosis, because that is where your healing starts. Trust me. I used to say it, and a lot of people are still joking with it. You see all those chronic pains. If you don't have any cyst, that does not mean you don't have endometriosis. You might have. I'm just telling you, there are 90% chances there is trace of endometriosis in your system. Just that they have not seen it in scan does not mean it's not there. So I will advise you to start treating endometriosis. Whether you have it or you don't have it, it's better you start taking stinging nettle. You have to be consuming, as you're taking ginger tea and taking all the hormonal herbs, be taking stinging nettle as well. That stinging nettle targets your uterine lining. That stinging nettle, the more you consume it, is going to reverse that endometriosis. It's going to heal your uterine lining. It's going to weak those cells. It is capable of killing that endometrial cells. So you have to be consuming that stinging nettle. You need to be consuming it. If not, you're wasting your time. So no matter any other thing you are taking, and you're not taking anything that is related to endometriosis, and you have endometriosis, but you're wasting your time. Yes, you are wasting your time. You see, this endometriosis, the thing will keep spreading in your system without you knowing. It will keep spreading. The only thing, especially normal endometriosis that happens around your organs, like your womb, fallopian tube, ovaries, that one can stay that place gingerly. And this one can be there without even disturbing you at all. It's only when you are seeing your period you will feel it, and you feel like, hey, it's just normal period pains. It's a lie, you. It's a lie. See, that one that will tell you is a normal period pain, or maybe when you give birth it's going to stop. And because of all this, a lot of women have entered into marriage with this endometriosis, and now they're finding it difficult to conceive. And the thing has been there, sis. It has been there. So if you're not doing anything on it, your own, you're not doing it to me. So if you keep having these pains, my dear, it's high time you can find something that is wrong with you and in fact, stop receiving blind treatment, because if you are not getting treatment for what is wrong with you, it will be very hard for you to overcome it. So a lot of women are just taking random something, as long, even if they say it's fertility herbs. As I'm mentioning fertility herbs concerning your own fertility issues, there are herbs that is suitable for you. Not because I'm saying fertility herbs, you want to jump on any fertility herbs that you see and you think you'll be fine. Make sure you're taking something that connects to problem you are having. I don't know if you understand me, okay? Because example, if somebody that is taking Vites just to help with high prolactin, and you that is dealing with endometriosis, you think if you start taking Vites, you also be fine. I'm just giving you an example. That their fertility herbs, please try to know what is your problem, because these fertility herbs also, they have their own distance where they work for, how they work in your system and the job that they do, because it's not only one hormones, that you have a lot of hormones starting from estrogen, progesterone, androgen, cortisol. A lot of things are contributing to your system. So what is wrong with this person might not be what is wrong with you. I don't know if you understand me. So make sure you are getting the right treatment and stop receiving random something or taking blind treatment, because it will be very hard for you to overcome that issue. Okay.